Hello, I'm Giovanna, International Clinical Manager from Intensive Medical. Today, the class is going to be about our LongPulse. The LongPulse is gold standard to treat vessels, and it's a good option for vascular surgeons. Here in Brazil, we have a KOL, Dr. Rodrigo Kikuchi, that is responsible for reduced class for these doctors. And let's start with the science and the technology. Here we can see the absorption curve. 1064 has absorption for melanin, hemoglobin, and water. And this wavelength has not too much absorption for melanin, and that is important because it goes deeper and we can treat vessels from face and legs. Here we can see the difference between 1064 nanometers and 532 according to the penetration. 1064 is deeper. In this table, we can see type of lasers, wavelength, absorption coefficient, and penetration. And here we can compare 1064 and the YAG, for example, with airborne YAG 2940. And we can compare them, for example, about the penetration. 1064, the deepest, and 2940, the most superficial. Features and technology. Our LongPulse 1064 is gold standard for vascular lesions treatment, as I already told you before, and we can work with these lasers with good results in hair removal, especially with higher phototypes. And we can work with dynamics mode and LongPulse at the same handpiece. Here we can see the commercial name, LongPulse. The wavelength is NDAG 1064. Pulse duration, 0.3 to 60 milliseconds. We can work in LongPulse and dynamics mode. The frequency is up to 10 Hertz when you are working with dynamics. And we have 2, 3, 6, and 9 millimeters spot size. Normally for vessels, we are going to use 2, 3, or 6, and 9 millimeters normally we are going to use for hair removal. And this handpiece has integrated cooling cooler. It's very important for us, especially when we're doing the treatments for vessels, okay? Here we have the screen. So we can see the fluency, we can see the frequency and the spot size with automatic recognition, and the pulse duration. When we work with LongPulse, it will be in milliseconds, and in dynamics mode, as you can see here, it will be in microseconds. The indications: vascular lesions. It's possible to treat the small ones on face, for example, and the big ones on legs. Hair removal, especially with high phototypes. And in dynamics mode, we can do thermal peeling, rejuvenation, rosacea flushing, and onychomycosis. Care and maintenance. It's very important to clean the spot size after the use. Normally, we recommend to use just alcohol, and we have the warranty of the handpiece in 200,000 shots. But when we work with dynamics mode, it's gonna be 1 million shots. If you want to learn more about the cleanliness or maintenance, we have our YouTube channel. We have there a lot of videos, but we have these videos in our site too, videncelaseraacademy.com. So let's start to talk about practice and clinical treatment. Start with vascular lesions. When you're going to treat vascular lesions, some questions are important. The target, the depth, and the caliber of the vessels. So normally when you start to talk about or think about the target, here the target is gonna be the hemoglobin. And we need to pay attention in wavelength, okay? The depth, we need to pay attention in wavelength too, but we need to pay attention in spot size. The caliber, pulse duration, and the absorption, the fluence. And about the parameterization, let's start with the spot size. With large spot size, the laser goes deeper. With smaller spot size, the laser goes superficial. So, to treat face, for example, small spots is better. And for legs, large ones. And we can see here in this table that when we work with small spot size, we have more difference in the penetration than we are going to when we work with large spot size. Okay, and as I already told you in the beginning of this presentation, normally we are working with 2, 3, or 6 millimeters to treat vessels. Okay, so normally we use 2 and 3 for face, and 3 and 6 for legs. Here we have an image to help us to understand the correlation between the size of the spot size and the penetration. Large spots, deep treatments. Small spots, superficial treatments. The other thing that we need to pay attention is the pulse duration. It's related to the vessel's caliber. Large vessels, longer pulse duration. Smaller vessels, short pulse durations. And we have here an example with 3 different kinds of vessels. The pulse duration is related to the TRT, or the time that the structure takes to lose 50% of its heat, and its change according to the size of this structure. It's very important to have in mind that the caliber and the depth of the vessels change. So we need to adjust our parameters during the treatment. The last parameter is the fluence. Fluency is different from energy. Fluency works with the energy divided by the area. So it's joules for square centimeters. Large spots results in more energy and less fluence. Smaller spots results in less energy and greater fluence. It's very important to pay attention on that, okay? And here we have a summary of the important points for the parameterization. According to pulse duration, spot size, and fluence, we can see when you have to increase or decrease these parameters. The correct parameterization guarantees the result without side effects. And we can see here, this is an article, and we can see we have efficacy even in blue and red vessels. It's very common to improve the results putting together the laser and the sclerotherapy. Normally, we start with 1064 and the YAG laser, and right after apply the sclerotherapy. As I told you, it's going to increase the results and normally can reduce the number of the sessions. And about the treatment of vessels, it's very important to be careful with dark skins and avoid tanning skins because we are normally working with high energy, okay? It's important to remove creams before the treatment. Use the cooling system during the treatment. It's very important too. The cooling system is going to give us safety during the treatment and reduce the pain. We can apply more than once, but we can't do stacking, okay? We can do one pass, wait some time and do another pass, but we need to avoid the stacking. After the proceed, we can use just a calming cream, or if it's necessary, you can put some anti-inflammatory cream. The interval is gonna be 30 days at the same area. And now, let's talk about hair removal with our LongPulse. For hair removal, normally we recommend to use 1064 nanometers and YAG for higher phenotypes or patients with darker and thicker hair. It's the best technology for higher phenotypes. It's safe because this wavelength has not too much absorption from melanin, okay? And we can apply with patients with tanned skin, but not the active ones, okay? As you can see here, it's very easy to apply. Normally, we recommend the skin dry and clean, short hair, and we can use Siberian or another cooling system together too. Not stacking, we can pass another time if it's necessary to the second pass, but we need to avoid the stacking. Normally we suggest 4 to 6 sessions, and the interval between them is gonna be 30 days or 45 days, okay? And let's talk about our dynamics mode. Our dynamics mode work with short pulses, and we can use this for thermal peeling, rejuvenation in general, rosacea, flushing, and onychomycosis. The pulse duration, we can choose between 300 microseconds or 650 microseconds or 1 millisecond. No pain, no downtime, and no problem with phototypes and tanned skin. It's very safe to do it. And it's very easy to apply too. We can see here in this video that is easy and fast. As I already told you, no pain. And right after the treatment, the patient is gonna feel just heat, and the patient can see a little redness. And the treatment, we divide the face in which area we're gonna do 100 or 200 shots. And if the patient reports too hot, we suggest to reduce the frequency and not the fluency, okay? The number of sessions, 1 to 8, with 15 days or 30 days apart. We have a protocol that we call Gemini laser, that when we put together our dynamics mode with our achroma, key switch laser. So Gemini here in Brazil is something like twins. And we call this combination with this name because we are going to work with the same wavelength, 1064, but with different kind of pulses. We start with key switch in nanoseconds, and right after we are going to apply our dynamics in microseconds. Okay, we put together at the same session, and we suggest 6 to 8 treatments with 15 days or 30 days apart. No downtime, no restriction about phototypes or tanned skin. And we can treat melanosis and flushing reduction pores. It's very good treatment. It's a very good treatment. And the last treatment that we can do with our LongPulse piece is onychomycosis. When you're going to treat onychomycosis, we need to produce heat at the needle. And it can be done with dynamics mode or LongPulse mode. It's important to clip needles prior to treatments. We suggest 2 to 8 sessions to notice the first results. It takes time. We can do the sessions with 15 days apart or 30 days apart. As I told you, we are going to look for the heating. So it's very important not to numb, not to use numbing cream or another kind of numbing, because we need the patient feelings, okay? It's very important that the patient tells us if it's hurting a lot or if it's burning or something like that, okay? To use the dynamics mode, we suggest 600 or to 800 shots at the affected nail. And it's very important not to use this barium because we need the heat, okay? And with LongPulse, we are going to use 6 millimeters spot size, pulse duration 40 milliseconds, and the fluency 4 to 80 joules. And we suggest 2 or 3 passes with the interval between them 2 minutes. Do one session, do one pass, wait some minutes, 2 minutes, and then pass again, okay? Here we can use Siberian together with the treatment, no problem at all. So here we are going to use 6 millimeter spot size, as I already told you. And when we're going to work with dynamics mode, it's important to use the 3 millimeters spot size. And that's the information I would like to pass to you. And if you have some doubts, we are here to help you. Thank you.